facilitate high quality research through increased resource allocation. You may have seen there was a publication recently showing that only 1% of global health spending, or global health research spending, is spent on traditional complementary medicine, despite so many people using it. Each activity direction, you have activities for the member states, for the stakeholders, and WHO. So I'm just listing here some of the member states, but Dr. Karim already showed some of the commitments that the African region made through the summit, which already gives a very good prioritization, I think, how the region wants to take this forward. So the second part of the objective on research is explore relevant research approaches and optimize the utilization of technology advancements. So there's a very clear recognition that to do rigorous research, you also need adapted research methodologies. And the Global Center has asked academics to come forward with a review of appropriate research methods, and so this is very important. And then there's, of course, the big theme of digital technologies, how they be used, and AI in the field of traditional medicine. The second objective is about the regulation. That will be a big part of the discussions here. One is on, so the direction one is to provide appropriate regulatory mechanisms for TCI products that are sustainable, produce, and supply. So you hear the word appropriate already means, you know, if you under-regulate, you have unsafe products on the market. If you over-regulate, you may not have any products on the market. So it's the appropriate regulation. That is what I want to highlight. What is new in this strategy is that in the past, WHO always talked about regulation of herbal medicines. And now we're talking about the full set of traditional and complementary medicines. So medicines herbal tomorrow. The second part of this is the regulation of practices and practitioners. We have so much expertise here in the room. About, again, having established regulatory mechanisms, have quality standards, develop guidelines, adapt WHO documents, and set training requirements and collect data. Now, the third objective is about integration of health systems, and this is divided in 2 steps. So step 1, or level 1, is the direction 311, which is more at the policy level. So integrate safe and effective systems into national and local health-related frameworks and policies for the integration of safe and effective TCIH. So this is where, you know, health frameworks, where health insurance, all these topics come in. And then the second part of that objective is actually taking it to the next step, to the real healthcare provider level. That's facilitating integration of safe and effective services across the care continuum and life course. And we'll here have the discussion on you know, case examples, how this is already happening across this region. And so there's not one fit for all, but for each country to explore, identify, design, and implement the most appropriate integration models, and where evidence coverage really to integrate actual treatments into treatment protocols. And the fourth one is about the cross-sector collaboration. So the first part is about how to work beyond only the healthcare sector, because good health depends on good food and clean air and good education, and so there's a lot to learn from the traditional systems and values and beliefs that can help in this cross-sector collaboration. The second part of this objective is about protection and access to traditional medical knowledge, and for the fair and equitable sharing of benefits arising from the utilization of such knowledge or associated genetic resources. So that is a very important topic. We'll only briefly touch about it in this conference when we talk about biodiversity, when we talk about a draft intellectual property framework that we're working with the WHO Global Center in this regard. So let me close here. I just want to give you this brief overview. I look forward to the discussion on the next 2 days. Thank you.
Thank you, Dr. Tido. Our next guest is Dr. Tido von now.